Stroke Awareness Month is a time in the year that has been designated for many years to try to increase the knowledge and awareness of stroke and what stroke is among the lay public. So there is an understanding that it's a disabling disease, but it's a preventable and treatable disease. Stroke is an illness that actually is the result of either bleeding into the brain tissue or a blockage in the blood vessel that keeps blood flow to going into the brain, such that that area of the brain that's not receiving blood flow suffers and dies. And so the idea is to identify this early, because nowadays we know that both types of strokes are treatable, and with that we can actually limit the degree of disability a person can have. The way to identify a stroke, the brain actually gives you signals right away, because when there is a part of the brain that suffers because there is a hemorrhage, or because it's not receiving enough blood flow because of a blood clot occluding or blocking a blood vessel, the brain gives signals in that part of the brain that suffers quits functioning. As such, the areas particularly more important are speech and strength. So most people will experience slurred speech or speech impairment, visual impairment, or they have clumsiness or weakness in one side or the other of their body. Particularly it's in one side or the other of the body. In terms of why we need to be aware of recognizing stroke and the importance of taking the patient quickly to the hospital has to do with the fact of what I already mentioned, that stroke is treatable, and by being treatable, one can limit the damage that a person can have, and as such, limit the disability. So the idea, and the earlier the brain is treated, the better the chances for a person to get better or have a limited disability or no disability for that matter. Now, in terms of how to identify it, one can use the mnemonics FAST. FAST has to do with the F represents the face or droopy face. The A represents the arm, that is to say, weakness of the arm. The S represents speech, and here we talk about impairment of speech or slurred speech. And T represents time, which is the importance of taking the person, identifying quickly the symptoms, and taking the person quickly to the hospital. The stroke service at UMC is one of the highest rated by virtue of having achieved the comprehensive stroke status accreditation through the Joint Commission. That requires a set of criteria that includes the presence of neurologists, the presence of neurosurgeons, the presence of neurointerventionalists, the availability of neurocritical care for the treatment and management of these patients, and so on. The requirements or criteria for this status is a very high threshold. That is to say, are criteria that are difficult to attain. But once the hospital has, it implies that has all the human and physical resources to treat these patients in a timely fashion. Now, in terms of stroke prevention, I mentioned initially that stroke is preventable and it is treatable. It is important to know that the best stroke is the stroke that never happens, and therefore prevention becomes key. El Paso, as a border region with 80% or so of Hispanic population, has a higher rate of stroke among its population. Minorities, African American, Hispanics, Asians, and so on, tend to have a higher burden of what we call risk factors. That is to say, high blood pressure, diabetes, obesity, and high cholesterol. So what is it that El Pasoans can do for stroke prevention? On one hand is to identify the risk factors, high blood pressure, diabetes, a high cholesterol, to be able to treat them and have them under control. The other side is to attain a healthy lifestyle with some degree of physical exercise and quitting smoking. So if one has to do anything it's better to try to prevent the stroke than to treat it. The Comprehensive Stroke Center here is to treat those patients that unfortunately go on and suffer a stroke. But everybody will be better off if we can prevent the stroke before it happens by treating all these risk factors that I just mentioned. I think the greatest misconceptions of stroke are one, that is a disease that cannot be prevented, and the other one that cannot be treated. The last 20 to 30 years of research have shown us that that's a mistake. Stroke can be prevented, and I think the population would get more, in terms of policy making, would be get more for their buck in trying to prevent strokes, because a larger population would be benefit by stroke prevention. But in those cases that cannot be prevented and the patient has stroke, early identification and treatment will decrease the chances of disability or death in these patients. So the greatest misconceptions are that stroke cannot be treated and stroke cannot be prevented, neither of which is true.